So today we're going to run through basically a normal oral cancer screening that we do here at Smiles by Hale. This is our lovely assistant Jen. She's going to be getting examined today. So the first thing we're going to look for is, I usually ask the patients if they've had any thyroid issues in the past. And with women, we have to actually get them to swallow to be able to palpate their thyroids. So Jen, go ahead and swallow for me. Good. And then we'll kind of work our way up in the neck structures, and we'll look at their submandibular and sublingual glands to feel if there's any little lumps or bumps popping up down here. And I'll always ask the patient if they've been sick recently or maybe had some swollen glands due to an illness. Then we'll move over and we'll check their muscles, and I always ask patients if they tend to clench or grind their teeth at night. Some people do it during the day. But I'm just palpating these muscles to see if there's any soreness beyond normal touching. Then we'll work our way up under the mastoid process of their skull, and we'll go up into their TMJ joints and actually ask them to do a couple of movements. Jen, go ahead and open as wide as you can and close. And then I'll try and change the position on the condyles of the lower jaw and ask them to open again. So open and close. And what we're looking for there is any abnormalities. Do we feel any popping? Do we feel any clicking? Is there any noises that get in there? Has their joint ever gotten stuck open or closed? Do they have any pathology that we need to further determine if there's anything going on there? Next, we'll start to look inside the mouth. And I'll take a little gauze, and this is usually uncomfortable, but this is what we're looking for so that we're doing a really thorough job for our patients. And I'll have Jen just gently stick her tongue right out for me. And what we're going to do is take a little piece of gauze and just wrap it around the tip of her tongue very gently, because I know this is uncomfortable for most people. And we're just going to kind of pull her cheek aside, and what I'm looking for is along the lateral border of her tongue, going back as far as I can to see if there's any abnormalities. And then we'll take a look on this side and do the same thing. And we're looking all along the lateral border. It's a very common area for precancerous and cancerous things to show up, especially in smokers and drinkers. So next I'll take the gauze and I'll just ask Jen to just gently say, ah. What I'm looking for there is to see if we can even see back into the back of her throat, into her oral pharynx, and see if there's any abnormalities on her tonsils, her adenoids, her uvula. And then we'll start moving forward, and I'll start looking at her soft palate and her hard palate, basically the roof of her mouth all the way back. And then I will ask Jen to just gently take the tip of her tongue and up to the roof of her mouth, and we'll gently palpate the floor of her mouth. And meanwhile, I'm looking to see if there's any, again, bumps, scratches, scrapes, cuts, anything that's out of the ordinary. And I'm palpating these same glands from inside her mouth, meanwhile looking at the floor of her mouth to see if we notice anything that's abnormal. The next thing I'll look at is her cheeks, the inside of her cheeks. We call it, the big fancy word for it is called buccal mucosa, but we're just trying to see if there's any, again, bumps, scratches, scrapes, anything out of the ordinary. I'm going to pull her lips aside. Again, this is kind of uncomfortable, but it's extremely important to determine if there's anything that's going on out of the ordinary. The next thing I'm going to look at is her gums. Again, same thing. Anything out of the ordinary, any discolorations, any red lesions, white lesions, blue lesions, anything that may be out of the ordinary, those are what we're looking for. And then we're going to look at the lips, especially down here in Florida. It's really important. We have a lot of outdoors people. We have a lot of golfers. We have a lot of fishermen. And lots of times we'll see some whitish striations or maybe even some discolorations on their lips. And either we can brush biopsy them. We have several different technologies. If I do see something that needs to be further evaluated, we can do something called ViziLite, where we have the patient swish. We turn the lights off in the room, and we determine if any of those little bumps or scrapes or anything like that warrant further evaluation. We have a thing called the VELscope, where we can actually do the same thing, and it tells us if it's normal architecture or if it's out of the ordinary. Or sometimes we'll even do a brush biopsy, where we actually just gather some cells from that little abnormality and we send it to our pathology lab at the University of Florida to see if it warrants further evaluation. Or if we can kind of tell what it is just from looking at it, we'll sometimes send it off to the oral and maxillofacial surgeon for an actual biopsy, either incisional or excisional. So that's kind of the importance, and that's why we do what we do here at Smiles by Hale.